Hi everyone. So obviously we're just done with the neat essays and we are kind of chilling in the chilly winters, but it's time for the roadmap or thinking about the INI-SS. And I just went through the AIMS website, the AIMS exams website, and also I was getting a lot of queries. And then I just realized that just now the neat essay is over, but still a lot of queries coming in, lot of doubts coming in with respect to the INSS. And then I realized that the date is kind of already out, at least tentatively, and it's not more than 3 months, around about 3 months. And I'm sure there will be a lot of kind of time waste around the NEET SS result, around the NEET SS counseling. So I think if you have given your NEET SS decently, or something that you are not very confident about, you should definitely start your INSS. And I hope you would have started INSS preparation in some sort of capacity. But with just around 3 months to go, I think it's definitely time to at least start, basing your prep, and then slowly plan towards how you'll execute things. Right. So I wanted to give you a little guidance on how INSS has shaped up, because this is something that is very specific. I've followed INSS right from the start. November 2021 was the first INSS. Before that, that was when it was first conceptualized. Before that, it was different separate exams for PGI, JIPMER, and AIMS Rishikesh in the context of Rheumat AIMS Rishikesh had a separate exam. Now, obviously, there's INSS. The pattern is 80 theory, 20 interview. Within the 80 theory, it's approximately 55 of the specialty. For example, rheumatology 55 and 20 of the general medicine part. There was no interview component initially. Only AIMS Rishikesh had. Now PGI also has that. So now AIMS Rishikesh and all the other AIMS like AIMS Bilaspur and probably AIMS Kalyani this time, all of these institutes have the interview. That is the AIMS merit list. The 100 marks will be counted to prepare the merit list for these institutes. And for JIPMER, it is only the 80 marks, the only those theory marks that are there. So that is how the pattern is. Right. So before INSS, as I told you, there were different institute exams, and every institute exam had a separate pattern. For example, JIPMER had something which was predominantly basic immunology oriented. Yes, rheumatology was there, but it was immunology oriented. Even the department is called clinical immunology. PGI papers were predominantly clinical rheumatology, like the proper rheumat oriented, very little of basic immunology. And AIMS Rishikesh was very much separate. Let's leave that for now because that's not very much important in this context. And probable paper setting source, again, this is something that is based on personal analysis and feedback based on whoever have appeared for the exam throughout these. And this correlated with the topic emphasis with institutional strengths. That is, the JIPMER pattern had basic immunology a lot. PGI pattern had a lot of vasculitis, etc., etc. Right? I will come to that. Right? So it was institutional based. Also, there was a certain pattern that I noticed. The first INI, the November 2021 INI was set by AIMS. Then the May 2022 was set by PGI. Then the November 2022 was set by JIPMER. And again, this is just personal interpretation. It wasn't written anywhere, right? So it's just almost like guesswork, kind of an informed guessing. Then again, it was AIMS, JIPMER, PGI, right? Keep this in mind why I'm telling you. And this was important because the question type were correlating with the institutes. As I told you, whenever JIPMER probably set the paper, there was a lot of basic immunology. There was a lot of Harrison based paper that was there. So that time, whoever read Harrison very well, classic Harrison questions from the lines, those very well, fundamental concepts of Harrison very well, they did very well. Then when the AIMS set the paper, AIMS was predominantly broadly balanced mix of pediatric rheumatology, clinical rheumatology, basic immunology. It was mixed. And also, I know it was noticeable that in AIMS, the textbook framed questions, that is, whatever lines are given in Kelly's, one paragraph will be taken, which of the following is wrong out of these four statements, and all the four statements are from that paragraph. That sort of questioning did come from your AIMS set papers, probably AIMS set papers. And when it is PGI, that kind of reflected the institute's legacy, clinical legacy of predominant emphasis on vasculitis. There were significantly more focus on systemic sclerosis, Sjogren's, which was not there in the other papers. Right, kind of that kind of paper was there, and also there were more medicine aligned questions, that is differential diagnosis of vasculitis. All of those used to come. So overall, while the syllabus is common, the question philosophy used to differ based on the institutes. And coming to probable question sources, they also reflected what I was telling you based on the institutional strengths. AIMS was predominantly from the Kelly's textbook of rheumatology. Few unconventional questions, few new questions did appear, but it was corely textbook driven. In JIPMER, the backbone was Harrison's rheumatology. Along with that, there's a book called QB's immunology. JIPMER paper was kind of based on that to an extent. Classic rheumatology was there, but there was also solid immunology fundamentals that was asked. PGI, however, it was not, the questions were not necessarily complex or very difficult, but the source was a little bit different. The source was very recent journals, nature articles, recent guidelines. Those kind of questions did come in your PGI. So AIMS, JIPMER, and PGI had kind of different probable question sources from where the question was framed, right? So if you look at it, if you're appearing for a new INI in this particular time period, it was very heterogeneous. You could never guess which institute is setting it. So performance in the exam did not be wasn't just based on textbook knowledge, but it was also based on a little bit of a breadth, right? The type of questions, trivia familiarity, recent literature awareness, conceptual breadth, all of these used to help a lot. And see, that was how also preparation was kind of aligning with that. So between 2021 2023, it was highly heterogeneous. There was no single dominant source from where you could read, right? So all of these quizzers and broad reading, all that helped. It was it was a little bit broad, not sharply focused. For example, if somebody read Kelly's very very thoroughly, there was no guarantee of them kind of reflecting that in the exam, right? So it was very diffuse preparation, broad ranging preparation. And when you went into the paper, that turned out to be kind of specific to the institute. Obviously, this is very retrospective thinking, but that was how it was at that time. So it was very basic, very generic, high variability trivia questions were a lot, but still repeat topics were almost always a strong fort. Why? Because in such a high variability exam, the repeat topics which come, they are difficult, they become disproportionately important. And this assumption is also based on the fact that institutes maintain q banks, not just institutes, even the INI, the exams excel also most probably maintain certain queue banks where questions, themes, they get repeated, reshuffled across exams. Not just the topics, even the exact questions you get repeated. Even now, get repeated across exams. And when there's no particular source from where you have to read, these become very very important, right? So that was how it is. We have obviously done all the recalls except the most recent recall, which I'll do in a week or so, along with the neat results. I'll do that. Otherwise, all the recalls we have done, right? So how the papers were set now from 2024. From early 2024, there was a clear transition. That what I noticed was, instead of this single institute based paper, there was somewhat of a mixed question profile, right? So 55 questions of rheumatology. Inside that, around 20 questions, 25 questions, they were very much mixed. Like they seemed that one question is coming from PGI, one question is coming from JIPMER, one from AIMS Delhi, all of that. So it was like a blend of institutional styles. But the rest of the 30, 35 questions of the 55, they used to come from a certain institute. So probably they had developed a bank. Some questions come from that bank, some questions they would have asked a certain institute to please give certain questions, and we'll put those. So plausibly that was what was happening. And the second shift was noted from November 2024 specifically. I think probably again AIMS said that paper, where a very substantial chunk came directly from your Kelly's textbook. And from there, these papers kind of started shifting to textbook based. And it has been, I mean, I think now it's three or four, I think three papers like that, which has happened, that it's very much textbook based. And even within textbook based, they were initially image based, algorithm flowchart based. Then slowly they have shifted to text and tables and flowcharts. Again, all of this is with respect to your important chapters only. I'll come to what are the important chapters, right? So important chapters text has now become very important. Also, again, this time I noticed that they are asking even from Hogberg also, right? So they're going little bit deeper, but at the same time, your focus is getting narrowed into textbook based reading, right? So it's like a central question bank is there, which is getting input from uh, textbook based questions. That is what seems to be happening, and the depth is definitely increasing. But because it is becoming textbook based, students are reading the textbook very strongly instead of reading generic video banks or generic trivia, generic journals. if somebody is going in that direction, they are taking a hit. So that is what is happening. So those who are reading textbook very well, they are doing the questions very well, even though they appear tough, because they've read, they are coming directly from the textbook. Because of this, there is an increase in the cutoff. I mean, if it's not an increase, at least the cutoff is being maintained, even though the questions are getting tough. And that the reason for main reason for that is the focus on these textbooks, right? So preparation today, I think I don't think anybody, any coaching or anybody would want to tell you this, but textbooks now have increased in importance very much. While the generic video banks, right, loads and loads of videos having a lot of rheumatology content from journals, from guidelines, from nature reviews, those kind of content, that kind of information has become lesser yielding. Obviously there will be some questions which will come from there, especially I'll tell to some certain special topics are there where again and again those questions are coming, where reading textbook is very difficult, or they're not there in the textbook also many times in a very articulated manner. Those topics, it's important to do a broad reading, but otherwise the importance of textbooks have increased a lot in the recent times. Quiz information, trivia, all of that has become less scoring. Prep is more focused. Generic video banks are not yielding enough results anymore. And obviously now this is based on the last 3 papers only. Now the next paper, if it is not at all Kelly based, not at all Hogberg based, I can't help it. This is just something that I've noticed a pattern of. And I think this is a pattern which will continue, because this seems to be a very fair pattern, in sense the important well written textbooks are being focused upon, right? So again, special topics, as I told you, one thing is pharmacology and rheumatology. This is something that I always, if you look through my recall videos also, all the recalls that we have done till now, all the recalls have a certain section called pharma and rheumat, because questions are coming every time. At least 3 4 questions come purely from drugs, and it's purely pharma, not like not from guidelines or something, right? So pharmacology and rheumatology is a topic that you have to read. If you can go through the videos, that I think I've summarized everything from both Kelly's and Hogbooks, the pharma part, in these videos. If not, if you're able to read textbooks and make notes from that, that is also fine. But I feel it's a little bit more lengthy. I mean, it's as bulky as your primary core chapters, which you have to read very well. So I would suggest you go through the videos. And another thing is outcome measures. So this is one topic which is not actually given well in your textbooks. If you go through, for example, this time in this particular exam, there were so many questions from your outcome measures. In spondyloarthropathy itself, I think 2 outcome measures were asked. RA outcome measures are commonly asked. This time vasculitis outcome measures, BIVA scoring was asked. So these things are definitely not given in a well articulated manner in your textbook. So this is one part where either you make your own notes from all your sources like your internet, etc., or you can go through my videos as well. They have also been well conceptualized in the videos. Then repeat topics, as I told you, even today they are very important, because the repeats are coming. Yes, some will be there in the textbook, not denying it, but some questions will be typical, will be a little bit difficult. But if you've seen them already, at least the questions, no need to go through the topics again and again from random sources, but at least the question, the answer, that you should be having on your tips. So I just prepared a list, your must do, should do, and may do topics. In a weird way, the must do list is getting kind of increased. It's good also, because otherwise the more you have in your must do, the more you can tick it off and complete it. If you have put very less in your must do, then again it becomes very ambiguous. So I think these things, Harrison's, especially from your Jipmer's perspective, very very important. This is something that is I think the highest yield, that is your repeat INI-SS recall questions. That is the maximum yield thing. Recall topics, at least of the last 4 sessions, you can be very 3 to 4 sessions, you can be very thorough of. I think that is also must do. Kelly's chapter. So this Kelly's and Hogberg now, because the last paper had Hogberg based questions also. For example, late onset SLE, things like this, right? In fact, late onset SLE was also a previous year question. Recall, you can put it into recall also. So either it was a previous year question, or it came from Hogberg. Any which way, I'm just putting 4 chapters only, and they're not very very big. These 4 chapters at least seem to be must do. SLE APS, I just put it in one. Again, chapters in the sense, no need to read idiopathogenesis in a very big way. Outcome measures also have, it's given very randomly in the textbook. You can go through it, but it'll take time for you to understand. I think you better go through my videos. It's much simplified there. The important ones are only given in the video. Otherwise, textbook, you might get confused. Then other parts like something like etiopathogens, histological features, they are not so important. The main things are your clinical features, diagnosis, management. Right? This is what is very, very important in these four chapters, which and spondyloarthropathies include all four, right? It includes psoriatic arthritis, IBD. IBD is not so important, nor is reactive arthritis, but at least ankylosing spondylitis, psoriatic arthritis is very, very important. And the other two are also very small chapters. You can complete them as well. RA, very, very important. Most of the times the questions are coming from textbook only, so definitely read that. Myositis, again, myositis is one topic with do questions do come from textbook, but also one these myositis antibodies, they always keep asking from random journals. Even if they are, just ignore that. Okay, you don't target that question, but otherwise the rest of the myositis you should be thorough with. Then the latest edition tables, especially of important chapters, we have done a session on this as well in our video bank. That is also something that is very obviously must do. Disease activity markers in 2025, increase disease activity markers and outcome measures both in 2025 November they have asked. Pharma and rheumat, as I told you, at least 3 questions or so will definitely come. GTs and QBank, that is needless to say, right? You have to do your question practice, because again, when you're reading textbooks, just highlighting and ticking it off doesn't work. If you're doing a very broad reading, it's a different thing. But if you're reading a textbook, QBank thing becomes very, very important. And especially DocTutorials, QBank, in a way, it would help you a lot because it is Hogberg based. Because Kelly's everybody is reading, so we made our QBank Hogberg based so that you have enough practice of your Hogberg information also, right? So at QBank you should do, and GTs obviously I'm sure everybody of you would do. At least in the last 1 to 2 months, you should give minimum of 4 to 5 GTs. Recall topics. I'm not telling questions. Recall questions is must do. When we come to the should do things, recall topics of whatever the previous year topics was. Clinical chapters of core rheumat topics. Like there are other chapters like apart from these four, like vasculitis, including IgG for rheumatic disease, scleroderma, SJS, JIA, sarcoidosis. These kind of chapters, again, definitely skip the etiopathogenesis part. Etiopathogenesis, you can just read the basic from Harrison. Whatever idiopath is there, that is enough, right? So except maybe RA also, just the antibodies is important, not the how the immune system is triggering all the quick motif and all the, just read the Harrison part, that is enough, right? So that is with respect to your clinical chapters of core rheumat topics. The non, apart from these four, the other topics are also should do. And latest ACR ULAR guidelines. Again, this is something that we discussed in our video, so that is also important. The latest ACR ULAR guidelines, and in our group also I've put the, for example, lupus nephritis, for example, there have been 4 guidelines that have come in 2 years. So I didn't do a video per se separately for lupus nephritis, but I made a small PDF and I posted in our group. The whole PDF I had posted. So things like that you can always get from our group, right? So that also I'll tell you, right? Important trials. Again, trials we keep discussing on the group. Very shortly, I'll be doing a separate video, because to be honest, doing a video on trials is very difficult, because if I do one video now, 6 months later I have to do another video. So I've done whatever trials I can teach you, I have done through the course of the video bank itself, but doing a video separately on trials is always challenging because I have to always update it. So I rather put things on the our WhatsApp group, so that people kind of can bookmark the message or save the message somewhere and read it there just before the exam. Finally, may do are the other chapters of Kelly and Hogberg. I don't think you should focus here. And even generic video banks, like having 3, 3, 4 hours on APS, I don't think it helps much. Rather focus on your Kellys and Hogberg, complete Kellys and Hogberg, and be thorough with that, right? Because those video banks, I feel, basic topics definitely you have to be thorough with, and you can use the video banks, or you can do Harrison rheumatology. But the other kind of things like having INI specific video banks, you can do it, you may do it if you are thorough with Kelly's and Hogberg, because that is how the current pattern is going on. So infectious arthritis, osteoarthritis, metabolic bone disease, pediatric rheumatology, all of these topics are may do, or you can rather skip them also, rather focus on the main topics. Do your Q banks very well, do your textbooks very well, do these special topics like pharma, repeat topics. These are what are important. Trials are also, this time trials have been asked. So if you can, just you can make an account on Twitter and follow certain rheumatology handles, because they post trials very, very regularly. So you can do that as well, right? And obviously whoever is not there in the group, I keep posting in the bigger groups, that whoever is focusing on INI rheumatology, they can always text me. And yeah, you can always ask me doubts. So I think this time NEET assess 2 3 topics we just discussed a week before the exam, right? So this cryovasculitis treatment, I'd even pinned this message in our group. If you are there in the group, you can look at our pinned message, which was pinned long back, which was the recent NEET assess question. So definitely I think you should join the group. It's anybody can join it. Just you can just send me a request and I'll accept, right? Any other doubt, you can always message me directly, ping me, or post it in our on our group as well. Okay.